Alright, hello, my name is Michelle. This is my video presentation for the Opioid Crisis project. I am here with my friend and my coworker, Michaela. Michaela, would you like to introduce yourself?
Yes, my name is Michaela Marley, and I am a new grad nurse at UMC on the Neuro ICU unit.
Okay, we work together. I've been working on the Neuro ICU for about a year now. Yesterday made a year of me being a nurse. So, just a little backstory. Okay, so today we're going to be talking about, like I said, the opioid crisis. It's not going to be long. I know you just got off work. I just got off work, so I promise I'm not going to keep you on. So basically, you okay?
I had to clear my throat.
Okay, basically the objectives of today are we're going to be able to describe the national opioid crisis with current statistics. I'm gonna explain the impact on healthcare systems, recognize the signs of opioid misuse in patients and in colleagues, identify community and organizational interventions, and we're gonna discuss how the opioid crisis applies to nursing in real life.
Okay.
And how we can make a difference. Okay. Okay, so let's start by defining what opioids are. Opioids are natural or synthetic chemicals that bind to opioid receptors in the brain and body, reducing the intensity of pain signals reaching the brain. This includes like prescription medications like hydrocodone, oxy, morphine, codeine, methadone, and prescription fentanyl. So basically, to break it all down, opioids work by attaching to receptors in the brain and nervous system to block pain. They can also produce a feeling of euphoria, which is why they're so addictive. We use them in the hospitals all the time for trauma surgery, especially in cancer. But once a patient starts building tolerance or taking them in higher doses than prescribed, that's when we run into problems. Illicit opioids like heroin and fake fentanyl pills, believe it or not, are what's driving the most deaths right now. Okay. So these are the stats. In 2024, over 80,000 people overdosed on opioids. And that's a lot of people, but believe it or not, it's actually an improvement from previous years. 2023, there were approximately 114,000 people died. So that is a 27% drop. And that's the largest decline that we've seen in a while. So although that is a significant amount of people, we're on the right track with what we're doing about it. And the saddest thing about it is that it's the leading cause of death for adults aged 18 and 44. Oh, no.
Is it going to start the video?
I hope not. Oh, I hope not. Okay. We're doing better, but we're nowhere near done. So, in addition to losing lives, the economy is losing a lot of money. Approximately $4 trillion was spent on the opioid epidemic in 2024. There has been an increase in ER visits, ICU stays, and long-term care needs. And most of these people, they're uninsured, so the hospitals love to eat those costs. It has led to staffing shortages, nursing burnout, and emotional trauma. As you can imagine, like $4 trillion is a lot of money, but if you factor in the toll it takes on the patient, the family, and us as nurses, it's a lot more costly than we can imagine. So now we're going to discuss some signs and symptoms of misuse. From a physical standpoint, the patient is going to have pinpoint pupils. They're going to have like I said, that sense of euphoria. They're going to be like heavily sedated, and then the biggest thing, respiratory depression. That's what we're losing a lot of people from respiratory depression. From a behavioral standpoint, they're gonna frequently request refills for the medication long before it's due. They're gonna claim that they lost it, and they're gonna isolate. And then your coworkers, you're gonna see a lot of mood swings, missing narcotics, and dropping performance. You might even see them. You know what a heroin, like a drug addict lean is, the nod. Where you like go to the floor, but you never hit the floor.
Yeah,
you might see that. Okay, we did that. Okay, the crisis has shifted a lot over time. First it was pills being overprescribed. Like, I think Big Pharma was basically pushing that, opioids weren't as addictive as they were. So they was overprescribed. And then heroin became the cheaper alternative because I guess it was really expensive. Now most overdoses include fentanyl, and people don't always know that's what they're taking. And that's scary, isn't it?
Yeah.
It's being mixed into other drugs like cocaine and meth, and that's where carfentanil comes in. It's so strong and a tiny amount can be fatal, and it's showing up more often. See, carfentanil is like 100 times more potent than fentanyl. And
like the regular?
Yeah, the regular fentanyl. And fentanyl itself is like,
potent
it takes just a little bit to do too much. And carfentanil is 100 times more stronger than that.
So is that where you see out in the streets?
Yeah.
Okay.
Yeah. You see a mixture of both. A lot of stuff like is laced with fentanyl. Like you, like I said, you might think you're taking meth. I mean, nobody should be doing drugs.
Right.
No judgment, but nobody should be doing drugs. But imagine taking one drug and it's a whole entire different thing, and now you've overdosed.
I think that's a big thing in like the adolescents. Like teenagers.
Yeah, like I said, that age group, 18 to 44, that's the young people. A lot of the unit, as you know now, it's filled with young people.
Really?
So, the community and organizational responses. So, us as a community around the country, we've been doing things to try to combat this crisis. Austin, Texas, they used a $2 million grant to reduce fentanyl deaths by 36%, which is a large number. Naloxone vending machines in Nashville dispensed 2,200 doses in 5 weeks, which is that's pretty impressive.
Yeah.
Syringe services and fentanyl test strips now legal in many states. This is the kind of response that gives me hope. When cities invest in smart harm reduction, they see results. Naloxone in vending machines, that's amazing. It puts life-saving medication directly in people's hands without judgment. Like, you can just go get what you need and make sure that you're safe. And you have other dispensaries that you give clean needles. And it may feel like we're enabling them, but, I mean...
With the Narcan
right, it's better to keep them safe than anything. So,
because that's what I was thinking at first.
I was like, I feel like I'm
but then again,
part of the problem.
It'll save somebody's life,
Yeah, like I was like, I feel like but they gotta be alive to get clean.
True.
So there's that. Okay. As nurses, we do more than we think. We can catch red flags before anyone else. We can educate patients and families, and we can advocate for safe practices, for more access to Narcan, and for laws that save lives. We can do things like check the prescription drug monitoring program, which is the PDMP, before administering or refilling opioids. Like I said, we can educate patients on safe use, storage, and disposal. We can advocate for harm reduction in evidence-based policies. And one thing that I've learned since being a nurse is that it's not enough to sit there and give the people the Narcan. You have to teach them how to administer it. Make sure they know and they can speak back to you how to administer it. Because those few seconds can really save somebody's life trying to figure it out. Harm reduction saves lives. Like I said, Narcan is now over the counter and it's pretty much everywhere. Medication-assisted treatments like buprenorphine and methadone reduce relapse. Syringe exchanges and test strips reduce infections and death. So they have clean needles and they have a way to reverse those drugs if they get their hands on them. Harm reduction doesn't mean we're enabling drug use. It means that we're giving people a chance to survive, which is basically what we discussed before. There's a little fun case study, but for the sake of time, I'm not going to get into it. Basically, the patient is a 45-year-old post-surgical patient. They want early refill. It seems drowsy all the time, and so far they've missed 2 follow-up appointments. You never really know.
Right.
All you know is that what your gut tells you. So in that instance, you would follow your gut. You would basically document what it is that you see, exactly what you see. Don't add anything, don't take anything away. Consult with your charge nurse to get her opinion on it or whatever the case may be. And basically, from there, you determine what kind of education or referral that you will provide to your patient if you thought that they needed outside help. I know we're busy, but and stretched in, and you know we're constantly running, especially as new nurses, trying to, you know, get our grounding or whatever. But we can make a difference. Don't underestimate how much power you have just by having a 2-minute talk with your patient about Narcan, and checking the extra record in the chart can literally save someone's life, and it can help them save someone else's life. So, like I said, you have to be alive to be clean. So, any questions? I hope you took something from that today. This is a list of references in case you want to do your own education, or in case you want to look up some more things. Some really helpful information. I'll send it to you.